Hello and welcome to my channel, Simetramind. I'm Dr. Lucid, an avatar created to bring you the most fascinating and advanced insights into psychiatry, neuroscience, and mental health. But behind this digital voice stands a real psychiatrist and psychotherapist with a subspecialization in geriatrics, someone who has worked with thousands of patients and has encountered some of the rarest and most bizarre psychiatric disorders in real life. Today, we are diving into a truly fascinating topic, the rarest mental disorders ever recorded. While conditions like depression, anxiety, and schizophrenia are well known, there exist a handful of disorders that are so unusual, so bizarre, and so rare that even many psychiatrists never see a single case in their careers. These conditions challenge everything we know about perception, reality, and the way the human brain processes information. I have personally encountered Capgras Syndrome 3 times and Fregoli Syndrome only once, and in that case, both conditions existed in the same patient. These disorders are incredibly rare, but they offer a window into the deepest mysteries of the human mind. Today, I'll take you through 5 of the strangest and rarest psychiatric conditions, explaining how they happen, what they feel like, and what science tells us about their underlying causes. Let's begin with Capgras Syndrome, a terrifying disorder that makes people believe that someone close to them, a spouse, a parent, or a sibling, has been replaced by an identical imposter. Imagine looking at your loved one, knowing that they look exactly the same, sound the same, and act the same, but being absolutely convinced that they are a fake. This is not paranoia in the traditional sense. People with Capgras syndrome don't just think their loved one is lying or deceiving them. They are certain that this is a different person who is simply wearing the face of someone they know. The reason this happens is a disconnect between facial recognition and emotional processing in the brain. Normally, when we see a familiar face, 2 things happen. First, the ventral visual stream, the part of the brain that processes faces, recognizes the person. Then, the limbic system, particularly the amygdala, triggers an emotional response of familiarity. But in Capgras syndrome, something disrupts that second step. The patient sees the person's face and knows who they are, but they feel nothing emotionally, leading their brain to conclude that this must be an imposter wearing a perfect disguise. What's even more bizarre is that if they hear their loved one's voice instead of seeing their face, they can recognize them normally. This happens because auditory recognition follows a different neural pathway, which remains intact. Capgras syndrome is often seen in people with brain injuries, dementia, or schizophrenia, and it can be extremely distressing for both the patient and their family. There is no simple cure, and treatment usually involves a combination of antipsychotic medication and therapy to help the patient rebuild trust and emotional connections. But what happens when the brain does the opposite? What if, instead of thinking a familiar person has been replaced, someone starts believing that strangers are actually the same person in disguise? That's where Fregoli syndrome comes in. This disorder, named after an Italian actor known for his rapid costume changes, causes patients to believe that multiple different people are actually the same individual, constantly changing their appearance. A person with Fregoli syndrome might be certain that their neighbor, their doctor, a stranger on the bus, and the cashier at the supermarket are all the same person wearing different disguises. Unlike Capgras syndrome, where emotional detachment is the issue, Fregoli syndrome is the result of excessive emotional connectivity. The brain overactivates its recognition system, creating a false sense of extreme familiarity with everyone the patient encounters. This can lead to intense paranoia, with some patients believing that they are being hunted, stalked, or followed by someone who keeps changing their identity to stay undetected. The only case of Fregoli syndrome I have seen was combined with Capgras syndrome, a rare and complex situation. This patient was convinced that their family members had been replaced, while at the same time believing that random strangers were actually the same person following them everywhere. This made it nearly impossible for them to trust anyone or feel safe, creating a state of constant fear and confusion. Fregoli syndrome is most often seen in schizophrenia, brain trauma, or temporal lobe epilepsy, and it requires a careful combination of antipsychotic treatment and therapy to help the patient regain a sense of reality. But some psychiatric disorders don't just distort perception of people, they alter the way we experience reality itself. That brings us to Alice in Wonderland Syndrome, a condition that makes the world feel completely surreal. Patients with this disorder experience distorted perception of size, shape, and time. Imagine looking at your hands and seeing them suddenly triple in size, or feeling like your entire body is shrinking. Imagine walking into a room where the walls seem to stretch and collapse like a dream. This is Alice in Wonderland Syndrome, named after the strange, shifting realities described in Lewis Carroll's novel. This syndrome is most often linked to migraines, epilepsy, viral infections, and even certain brain lesions. The reason it happens is that the occipital and parietal lobes, which process spatial awareness and visual perception, start misfiring, causing objects to appear distorted. Most cases are temporary, but they can be terrifying while they last. While Alice in Wonderland Syndrome distorts perception, some disorders destroy the very concept of self and existence. That's what happens in Cotard syndrome, also known as the walking corpse delusion. Patients with Cotards are absolutely convinced that they are dead, missing their internal organs, or that their body is decaying. Some refuse to eat because they believe that food is pointless if they are already dead. Others isolate themselves completely, certain that they no longer exist in the world. Cotard syndrome is often linked to severe depression, schizophrenia, and brain damage, and it represents one of the most extreme forms of psychotic delusion. Interestingly, electroconvulsive therapy, ECT, has been one of the most successful treatments, suggesting that Cotard's is caused by a severe disruption in the brain's self-perception networks. The final disorder I want to talk about is Pica Syndrome, a condition that causes compulsive cravings for non-food substances like dirt, chalk, metal, glass, or even soap. This might seem strange, but pica is more common than most people realize. It is often linked to nutrient deficiencies, obsessive-compulsive traits, and certain developmental disorders. In extreme cases, patients can consume dangerous objects, leading to intestinal blockages and poisoning. These rare psychiatric conditions challenge everything we think we know about the mind. They show us that perception is not fixed, that reality is shaped by the brain, and that even the most fundamental concepts like identity, existence, and self-awareness can be shattered. I'm Dr. Lucid, and here on Simetramind, we explore the most mysterious and mind-bending conditions in psychiatry, rare mental disorders, and the future of neuroscience. If you're fascinated by how the brain can deceive itself, subscribe now and check out my next video on how psychedelic substances like psilocybin might offer a whole new way to treat mental illness.